Thank you, Mr. Speaker. Good evening. I rise to make a few comments, but also a question to the proponent of the bill. And my comments are, I come from a community that received for 4 years in a row accolades from the national organization America's Promise for one of the 100 best places to raise young people. I always said it was because we didn't put our heads in the sand, that we took the time to address issues. And I was very sad several years ago when one of those issues became prevalent use of drugs among our young people. I'm even sadder today as in 2015, we had 11 deaths related to opioids. And just to this year, we have 2 deaths and 6 pending medical examiner's report, all young. We know that opioids are easy to get, and that if you asked half of the kids in Connecticut, they would tell you that they could get a hold of opiates within 24 hours. So I appreciate that we are bringing this bill forward and that we're looking at addressing an epidemic and a crisis. But I do have one question through the proponent, through you, Mr. Speaker, to the proponent of the bill regarding the council and the working groups. I'm looking at the website that cites the meetings scheduled for the council. And one was on March the 1st of this year, and 3 others are scheduled, June 7th, September 13th, and December the 6th. And this bill says that they are to have a report to us that contains measurable goals, including but not limited to a goal for reduction in the number of opiate-induced deaths by January 1st, 2017. And through you, Mr. Speaker, I'd like to know if the chairman of the Public Health Committee could outline how that work is going to be done when we have 3 meetings left. Thank you, sir.
Representative Ritter.
Through you, I would just say they're going to have more meetings. And so statutorily, they have the website lists 4 regular meetings. They can always call more meetings. They have these new subcommittees. I think our goal is to light a fire to get a product more quickly. We've been in consultation with the commissioners who have oversight over this relevant commission and the governor's office. People are aware of what is being expected through you, Mr. Speaker.
Thank you, Representative. Representative Staneski.
Thank you. I think I pushed the button by accident. And I thank the good chairman for that answer, and I agree that this is a tall order for us, and it's an issue and a crisis that definitely is going to take some time, good thought, and input from many people who are on the floor involved. I know I had a conversation with the good chairman about the regional action committees and the information, and I was glad that I continued the conversation with the Demas rep on how we can include them in true, meaningful steps forward. Recently, I attended a forum by the Commission on Children on opioid use in our neighborhoods. And some of the things that I'd just like to comment on that I hope will take forward with the council members who are here, as Representative Gibran is, and representatives that are listening who sit on this council and may be part of the working group. We need to look at the continuum of care. When I talk to people in my community and people in other communities, we need long-term treatment. 30 days in and out is not doing it. We do need to get rid of the stigma, as my colleague said, because what I hear from young people in my community and those who are taken to the emergency room and then back home, the stigma of this illness, this disease, actually keeps them sick. And we need education. I spoke earlier about my community addressing underage drinking and substance abuse, and we found that the education that we put in place actually worked to reduce those 2 components. What we find now is there's an uptake in prescription drug use, one of those pieces that we did not address. So we need education. We need to look at family addiction and how that impacts those who are using. and children of addicts. We need to look at prevention, and I think it was already mentioned, the marketing, the ads that market, you have a problem, here's a pill to solve it. And that's a cultural issue that I think requires an environmental strategy to be embraced by this chamber and by our communities. I don't know, I think that those ads are regulated by the federal government, but we bring House resolutions forward on just about anything here, and certainly that would be one that I think would get full support of all of our members if we could build a resolution, send it to our Congress that these ads have to stop. We need to treat it as a disease. We need to look at our treatment centers because they're not equally providing treatment. Some treatment centers are licensed and some are not. We need to look at that circle of blame that takes a lot of those who are using and puts them in a back corner. There's a walk in September that's done in Milford. And one of the pieces to that walk is where people have lost their children or their loved ones, their brothers or sisters to this epidemic. 3 years this walk has happened. In 3 years, those pieces that have those names on it have increased. I know this is a lofty goal for us. I hope we do it methodically, and I hope those working groups that are concluded will include the stakeholders at the local level. We need to continue sharing this, and I applaud us bringing this forward, but I hope it's not the end. I hope the end is when we say there are no more deaths. Thank you, Madam Speaker.
Thank you, Representative.